Hello, this is Dr. Troy Ryan with High Caliber Chiropractic. Thanks for watching today. We're going to be talking about instrument-assisted soft tissue mobilization. In my practice, I specifically use an instrument called Zuka Tools, which can be found on zukatools.com. I've got the instruments here in front of me. These instruments are used all over the body, from larger muscle groups to very small intrinsic muscle groups, very short muscles. Some of the smaller muscles that I'll use the instruments on might be hands and feet, or the intrinsics around the spine, the stabilizer muscles. Let's go to the first one. This one is the largest, we call this the handlebars. It's the largest, the heaviest Zuka tool. I'll use this over the quadricep muscles, the hamstrings. I might use it over the calf muscles, some of the back muscles, upper shoulders, upper traps, levator scapula, where I can take this with two hands and I can literally dig in with a lot of my upper body weight. I can actually put a lot of pressure into the muscle as I go up, and then I turn it to come down. All of these instruments are double beveled so that you get a good flow, good stroke along that muscle. A lot of times I'm going with the striations of the muscle. Once in a while I might go a little bit of an angle, or sometimes I might do a little bit of cross fiber friction where I'm going more horizontal against the plane of those striations of the muscle. This next one here is probably the instrument that I use the most. Almost looks like a small boomerang. Again, double beveled. I can hold it in a variety of different positions where I can use this to, again, I'm breaking up scar tissue, I'm breaking up fibrotic adhesions, trying to decrease inflammation, soft tissue swelling in the body. What we want to do is mostly we want to accelerate the tissue healing process. We want to decrease that inflammation, we want to decrease those adhesions in that scar tissue so we can improve overall range of motion and mobility. We want to take a tight, shortened, rigid muscle, and we want to elongate that muscle. We want to excrete all of those pro-inflammatory mediators, the lactic acid that might build up in the muscle, excrete that to allow that rich oxygenated blood to be introduced to the muscle. Again, that's going to speed up that healing time. This instrument specifically has two curved edges to it, so I might be able to use this around the front of the shins, around the top of the ankle. I might be able to use this instrument specifically around the elbow. You can see that the contour of my elbow on the inside here for something like a golfer's elbow or a medial epicondylitis specifically could be used to break up some of that tension tightness around the inside of that elbow right there. Same thing for the outside, more of a tennis elbow for lateral epicondylitis. I can take this if there's a lot of tendinitis or tendinosis around those tendons. I can literally break that up. I can take the stress off those attachment sites to the elbow by actually scraping off those adhesions, breaking up that scar tissue, getting rid of that inflammation, really loosening this up so that the patient can flex and extend their wrist significantly better. A lot of times I'll do pre and post tests, right? I'll have the patient show me how far they can flex their wrist versus extend their wrist. And then we do pre and post. After treatment, we get to see the changes in that, which are pretty remarkable. This is the smallest. It's got two edges for two different purposes. A lot of times I'll use this shorter curved edge here if I'm working on areas around the hand and wrist injury specifically, where somebody might fall on an outstretched hand and injure their wrist or their hand or their fingers. I can use this smaller, shorter curved edge to actually get between the fingers, around the thumb, around the wrist. You can see how that almost perfectly wraps right around my wrist on the inside or on the outside. I can really get in there to break up a lot of that scar tissue that might start to form over the time of the injury. Thank you so much for watching. If you have any questions, feel free to leave a comment, feedback, question on the video. You can always reach out to me at highcaliberchiropractic.com or directly with the website for Zuka Tools. It's zukatools.com. And thanks so much for watching.